Good night, Mia.
Hey, friend. How are you?
I'm all right. How are you? How was your day?
Ooh. Sorry, friend. What you say? How are you? Oh, you're muted.
Oh, I was saying you have on a Trump cap or what?
Oh, no, ma'am. That's a no. No. Not nice.
Girl. Oh,
it's been a long 2 days.
Oh, yes.
Is it safe to say it's been a long year already?
Oh, if that's how the year starts, we don't want to see what's coming.
I can imagine. I can only imagine.
Oh, Lord.
All right. I'm moving around in the background. I'll be right back.
Yeah, I'll mute myself until I see people start coming in.
Hey, good evening, Enid. How are you? It's Mia. Happy New Year. Oh, you're muted.
How you doing? How's everything? Happy New Year to you too.
Yes, pretty good. Can't complain.
Thank goodness. Good to hear from you.
Yes, great to see you.
Hello.
How are you, Miss Leopold?
How are you? Happy New Year.
You too. You looking good?
Thank you. You do the same. You're like, wow. You look like you're just coming from the Caribbean from vacation.
Listen, from your mouth to God's ears, that's my wish.
Mr. Burke, how are you, Mr. Burke?
Hi, everyone. I'm good. Happy New Year to everyone. What's going on?
Happy New Year. Happy New Year, Enid.
You too. You too.
How are you and the family doing?
We're doing great. It was a wonderful, quiet Christmas and New Year. My family's all spread out, so we had a Christmas Eve Zoom.
That's just terrific.
Yeah, it was really nice. And most of my relatives are at least 70 and older, so it was very fascinating for them to be able to see each other. My mother's siblings are all over the world. It's London and Vegas. It's, so for them to be able to see each other and talk, it was really nice.
That's wonderful. And I'm sure if there's any youngsters involved, they probably just loved it.
We had the youngest on the call was 8 and the eldest was 90. So we had that.
Wow.
It was really great.
Yeah, it was wonderful. Terrific.
Mm-hmm.
That's terrific.
Wow, awesome.
How are you, Francesca?
Awesome. Well, I am good physically, mentally I'm not.
Yeah.
Because I think I'm watching too much CNN and MSNBC. So I mean.
Yeah. Well, look, it's a terrible thing that happened.
Yeah.
Oh, yeah.
I have to tell you, for my own mental health, I have really cut down on the amount of news I watch.
So do I.
And it started with COVID because I just couldn't handle it. But my recommendation is cut down on the TV.
Yes, indeed.
Yep.
My light is so bright.
Yep. Ingesting that is most important. Yep.
No, it's like, because I work out every morning and I used to watch the news and then now I watch Law and Order reruns.
You're right about that. You have to escape. Yep.
Yeah, I just couldn't. Yeah, I just couldn't handle it.
Too much.
Because this is unimaginable.
Yeah, it is. It is.
And I'm pretty old and I've lived through a lot of stuff. So.
Right, and never thought you'd see anything like this, though.
Nope.
And you're wondering what's gonna come next,
Right.
Yeah.
Yeah.
Right.
Well, I'm assuming, based on my living experience, that things will fall into place and maybe a couple of outbreaks, but someone compared this to 9/11, and it's very similar psychologically. Okay, that our country's fiber was threatened. So, you got to really think about that and what's going on. And for the first time, well, it's not the first time, but the last time they were talking about impeachment, I thought it was political. At this point, I think it's necessary. So.
Right, absolutely.
Those.
Well, I was just saying to myself, if I have one person, because I say, if I have one person, I'm gonna have the meeting with one person. And then I came on and there you were sitting with Lauren. So at 7:10, if just the three of us, I'm gonna have a meeting with just the three of us.
Yeah.
Hey, nothing wrong with that.
That sounds good to me.
Yeah.
I'll be a good company.
I mean, the important part is we have the meeting.
Exactly.
Yeah, definitely.
And then it's up to people to decide whether they want to attend.
That's right.
Yeah.
And by the way,
But
I've known Francisca for quite a while, and I like having meetings with her. So that's that.
Well, we've just met and I like have meetings with her. So there you go.
All right.
And I must say that Warren, I like when you attend my meetings and you always support me. And in it, I, you know, from the very first time you came, you have been a good support, and I really do appreciate you, coming and being there and sharing with us. And I think that this year we will do good things together.
Oh, definitely. It's my pleasure.
So I'm happy to have you on board.
Happy to be here.
Well, health is the #1 issue as far as I'm concerned right now. And there's so much going on and things move so quickly. And this is a very important meeting. Though I will say that things are much calmer at this point in time versus last March.
Right.
So it's pretty positive to me that, our major health facility in our catchment area is, I'll report tonight, but it's very positive. And not that things aren't negative in terms of COVID, but the process is much, much better because they learn quickly.
Yeah.
There's a great leadership team.
From March, from what happened in March, they were able to use that information to inform decisions now.
Correct. As well as, the other interesting part is the public, our residents, people have become much smarter. I've noticed in most of our catchment area that, people are really taking precautions. And the result of that is that people are well informed, where in March and April and May, people would get sick and didn't have any idea what was going on. It could be a cold, it could be a virus, but now people are so
Mr. Burke, I don't want to cut you off. Remember your last words, for you could continue that conversation, but I would like to start officially. Okay. It's now 7:10. And I would like to welcome each one of you for being here on this January 7th, our first meeting for 2021. And I'm happy that we are here in sound mind, and I would say good health, and then it is something that we should be thankful for. I'm always willing to give thanks because I'm not taking my health and my life for granted.
Right.
And because there are so many people out there who are not as fortunate to be sitting in our seat right now. Some of them could be in the hospital, and some of them could be in the cold storage, or some of them could be crying because of the passing of a loved one, so those moments and minutes and hours of our time, we shouldn't take it for granted. So I thank Mia for being here. I thank you, Enid, for being here, and for Warren for being here. For last month, we had some very good information from, I don't think, Enid, you were here last month. Yeah. And when we look at the ratio, and we look at the percentage of our number of cases in Brooklyn that was presented to us, it was at 86,000 cases in Brooklyn. And we know from last month to now, it has increased. The percentage has increased a whole lot. And also the percentage of death in Brooklyn was at 6,000, and we know that number has increased as well. So for the month of January, Mr. Burke is working as the chair for the CABS at Kings County Hospital. So we will have somebody who is going to come in, because we know that we have those 2 vaccines that came out, the Pfizer and the Moderna, and a lot of people, they are questioning as to, the difference in the 2 and which one is better. And as we've heard a report, that the Pfizer is better. And when you look at how they do storage and how they are working out with the Pfizer, I myself, although I am not an advocate for vaccine, I think that it's better because I know the Moderna really, it benefits people who are living in the rural areas because they don't have to get that extent freeze of coldness for it. You can put it in the cooler and go out to the, but as anything as it was mentioned to us is that the preservative in it gets into your bloodstream and it stays there. And sometimes for some people who have underlying medical issues, it kinds of weakens the immune system. So as I'm not a medical professional, so that was my take. I'm like, I don't want it. I'm not in favor of it. But the community at large have concerns about the vaccine, and we know because of the percentage, and even with the flu, because if you would remember the doctor, he was advocating for people to take the flu vaccine, which I take every year. I took the flu vaccine just once and I got sick, but all the other years I have been taking flu vaccine. It's always been good because I will feel the incoming of the flu, but whatever, my body fights it out. So I encourage people to take the flu vaccine, and he is encouraging people because he says that you taking the flu, getting the flu and catching the COVID, you don't know between the two, and you don't want to have the flu and catch the COVID, and it is a death sentence for you. So he was like, it is better. And even now with this new strain that's coming now, and it's already upon us, you know, and it is very important. I know a lot of people say, well, I ain't taking the flu vaccine. I've never taken the flu vaccine. But before that, it was okay. But what we are dealing with now, and we don't know as to how long COVID is around, and the new strain that's coming, it is more contagious. And I think a lot of people who caught COVID and people, family members and friends never thought that it would have been their demise because they had underlying conditions and they didn't even know. Right. And many of us have underlying conditions because a lot of people don't go to the doctor, and because they don't feel sick, right, they don't go for checkups or anything. And there are things building up in their bodies, something going on in their bodies, and they don't know about it, you know? Right. And then when they get that, when they got the COVID and it attacked that weak point in the bodies, and then, hey, all hell break loose, you know? So I think it is something that we should encourage our families and our friends to take the flu vaccine, which is very important, and to be cautious because we have young people. They go out there, and a lot of people have this notion of saying, oh, because it's family. Your family is your worst enemy. You understand? Because a lot of people is like, oh, my family is coming, I'm accustomed to this person's, but your family goes out there and you don't know who they interact with. You understand? And what precautionary measures did they take with their interaction with people on the outside, you know? So we have to be very careful. And even at our doors, we have the mailman and UPS, they come, they ring your bell, and you come right behind them, you don't touch them. They come, they hold your handle, your gate, they touch your gate. You know, so many people will be, you know, there's so much that happens just at your doorstep that would affect you. Because there are people who say, I don't even go out, but their families come to them. So going back to the vaccine, Warren was working on getting somebody from Kings County Hospital. And for this month, our general board meeting, he will be doing a presentation on the vaccine, you know, so anybody who have any questions, that the persons could ask that question. So you could invite anybody who wants to come, and anybody in the, we can let people know that somebody will be there to answer the questions.
Francesca?
Yes.
I can update that. I just got off of some meetings,
yes,
and we will have a clinician at the next board meeting to review the vaccines and to approach the rumors that have been identified and to answer any questions. So that should take place at about 7:15. I have to speak to Mira and Fred, but that will be available to the community.
Yes, thank you, Warren. Yeah, so as so we will have that, and then also I spoken about the flu as well. So we looking for people to really, go ahead and do the take the flu shot. We know that they spoke about the zip codes in our community as to where the the virus was more, the percentage was higher in the 11216 area and the 11215 area codes, also 11213 and 11233 and 11238. These were the areas that they were, really looking at. So we are just hoping, that the people are taking the precautionary measures that, that they need to take. I have to work. I know it's getting very cold right now, and I don't know how it's gonna work out. Maybe we have to really gear down for the coldness. I know the 71st precinct, they're always willing to work with us when it comes to transportation and working with us. They're always happy to work with CB9, because I know Ms. Dillard, that you said if we needed any more masks, that they were available. And I've been thinking as to, because the areas that we give masks at Utica Avenue and Eastern Parkway.
Okay.
We give masks at Winthrop, in this our area. Mm-hmm. But my issue is that people in our community, they need a lot of masks. They do need masks. And what I find is that Utica and Eastern Parkway, the people over there, they are not in our community. The majority of them are not in our community, mm-hmm. because they're taking the trains right there, and we want to serve the people in our community.
Right.
So I will be sitting with Mia to find out as to a day, maybe once a week, we can go and just hit the train stations. So we can hit this President Street train station, maybe just 1 hour. We can then hit the Student Street train station. We can hit the Winthrop train station, just in this train station that's within our
right.
the confinement of our district, mm-hmm. that will go out there. So we can go to each one of them, and maybe 2 of us. So we get, because usually the precinct would send a van, and they would would put the box in there, and then they will help, and then we can distribute. So we know that the people in our communities, because what Mia did the last time, she had them in the Ziploc bags. So we could put like 3 masks or 4 masks in a Ziploc bag. And as people come out of the train station, we give them. And there are other people who walk the streets. And when you look at them, you can tell that they are in need of a mask, because you could look at the mask on their face and you could see how, dirty it is. And so, so we would best be giving out. So if we have 1,000 masks, we just give 1,000 masks and we're gone.
Okay.
Whatever that we can give, if we give out 500, maybe we could split it. We can give 500 one week and give 500 another week, we can just give it like that.
So we should organize with you then for next week to get at least 2,000 to you.
Yes. Amia, how many masks do we are not talking about the ones from Miss Waterman, but what Miss Dillard gave before, how many do we have left back? You have the approximate. Do we have any left back?
Yeah, there's a good deal left back. We haven't done any disbursement since we partnered up with Asante and their pop-up COVID mm-hmm. testing. So we haven't been out since. So there's a large amount that we definitely have a good amount, but they really go fast because we notice people want at least 2 and 3 at a time.
Right.
Especially once they notice that it's not the regular medical one, it's the KN95. They see it and they're like, oh wow, okay.
Right. So you have from Miss Waterman, and do you also have from what Enid gave you before?
Yeah, that's what I was referencing. What Enid gave us.
Okay. Also, the ones that Enid gave, they are the N95?
Yeah, they're the KN95.
Okay. All right. So we will touch base, and then I don't know how Enid, how you knew your schedule go if you want to join us, but however, we will just target the areas outside the perimeters of the train station, and just give them as people come out,
right.
And then we and give them out, because although I know that we have a whole lot of people on Utica, but as I said, that we have all the buses that go to all over on the other side, and a lot of the people, and they bomb rush you, and they don't live in the community, and we want the people in our community to really get, get those. Also, if we got, I don't know if we can get these small hand sanitizers, and then we can just put 1 or 2 inside the bag for them as well.
I'll see what I have. I know I have masks. I have tons to give, but the sanitizers go quicker, but I will look.
Right. Okay. All right. Hi, Miss Lewis. How are you? Welcome. And
happy new evening. Thank you.
You're welcome. So with that, so for the month of January, I'm looking for us for this month. The scheduling for this month is to have and the update for the vaccine, and then also to give out the PPAs. Maybe Mia, we could talk for next week, and we could schedule a day for next week. One day next week, maybe a Friday. Most likely, I think that a Friday is better. So you let me know so I can work according to my work schedule to fit it in. So for next month, what I'm looking, I know the lady who came, Ariel Solkov, she spoke on obesity, and it was a very good presentation, and I would like her to come. So for the month of January, so right now, what I'm throwing out, I need your opinions, I need your input, I need Ms. Lewis, I will, when we get to the other section, you are coming up when it comes to HIV and sickle cell. But also, I just need your opinion. So I was looking to merge the obesity, diabetes together for the month and have a presentation on both. What do you think? Should I do the obesity awareness 1 month and then diabetes 1 month? What do you think? Because I know yeah, go ahead. Somebody who's saying something.
This was Sabrina. Hi. I think that the obesity and diabetes goes together. If we do public health education on the obesity, then we can prevent and eliminate diabetes from running rampant pretty much in the community.
Yeah. I was thinking the same thing, that that we should do the obesity and diabetes 1 month. But you see, my thing is that in order for us to have a dialogue or a presentation on that, it would have to fall into this time of my section. So we could give somebody, a presenter, half an hour to come in and do a presentation. But then as the chair did advise me before, I would have to let the board know. Then we'll put a flyer together and give it to people so that they can send it out to the connection, so we can have people to come on board and to listen. Maybe we can even have it go live on Facebook also, because our general board meeting, it's so packed that you don't have enough time, for whoever doing the presentation. They don't have enough time to do the presentation and then to have dialogue and ask questions, and all that. And they would only have like 5 minutes, or the most they could have is 10 minutes, which is very rare, because of all what we have already on the agenda for the general board meeting. So for the community meeting. So what we need is, I would like it to be like on a Thursday, the first Thursday of the month, and then we'll use this platform and this time so we could do our introductions and whatever, and then maybe 15, 20 minutes of our introductions if we have anyone who wants to introduce themselves, and then the persons who are coming in to do the presentation, we can give them the rest, because usually we just have, I usually have this space for 1 hour, because I don't like, during the day, so many meetings already, so I don't want to keep people for too long. So for that hour, so the half hour, we just give them that half hour for the presentation and for questions and answers. And if we take less than the hour, then we close down. So I'm looking to that for the month of February. And then for the month of, before I move to the month of March, any suggestions? No? Okay. And so going to the month of February, that's where Ms. Lewis, you come in, because from the month of March, I would like us to bring back that AIDS, because I realized that, and as you spoke about last month, a lot of people has just pushed AIDS on the burner, no, under the carpet. Nobody talks about AIDS anymore, but AIDS is still there. It is still affecting our community, you know? So I would like us to do the HIV/AIDS, and as well as the sickle cell. The floor is yours, Sabrina.
Happy New Evening, everyone, again. So the HIV/AIDS, Madam Chair, you're referring to in March, yes?
Yeah.
Okay, so we can do that in partnership with the Social Justice Imperative. And excuse my camera being off, the multitasking and traveling right now. Did you want to do when did you want to do the sickle cell? Sickle Cell Awareness Month is in September, and also Juneteenth, we celebrate sickle cell awareness in June.
So you think you think we should push it back?
I think we should wait until June to do the sickle cell.
Okay, so we're gonna do the HIV in March.
Yes.
Okay. That works for me. That's fine. Okay, so March. So in April, I would want us to do a forum on maternal health. And yes. I attended a summit with the Department of Health, and I was one of the panelists. And it is a big thing. I think that it has even gotten worse since COVID. So I've had so many complaints with pregnant mothers, teens, with issues with being pregnant and going to get the services being rendered to them, and the treatment that they are getting. And it's a big thing. It's a big thing. And Department of Health, they would like to work with me. They would like to do a presentation. And we also have some other organization who would like to come in, you know, and do the presentation with us also. So we'll have a panel. So we'll have about at least maybe 3 or 4 persons on the panel. So we'll have doulas, and then we'll have nurse professionals and midwives. We have a few people who will be coming on board, people who have had experiences, you know. So I'm looking for April. And so this is a big thing that we have to plan. And as anything else, the time, the same thing, we will have the time allotted. We just welcoming everybody and give people the time so that they could come in. And so it's gonna be maternal health and COVID, you know. So it's something that I'm really looking forward to. In 2018, the Department of Health came to the committee, and when we had that roundtable, Ms. Lewis was there. We also have, I will also look to see if Yvette Clark will be available, because I know she's available on Thursdays, so most likely she'll be available. I'll have them to check her schedule to see if she can attend, because when we had it in 2018, Ms. Lewis was there. We had 3 persons from Department of Health. We have Assemblywoman, Congresswoman Yvette Clark, and it was a very good discussion that we had. And then, you know, people were like, you know, we didn't know about this. You know, you didn't put it out there, and the community needs to know about this. And then we have a lot of complaints, and we have people who are pregnant and they had COVID, and then they were pregnant and they go to health facilities and they were trying to breastfeed their babies, and the doctors told them, hey, you can't feed, you had COVID and you can't feed your baby in public, you know. So there are a lot of different things that have been going on, but those issues are not issues that we're going to check, because these are issues that for my job, I working with the Commission on Human Rights. These are cases that come to us and people who are going through discrimination because of COVID. So they're going through discrimination, COVID discrimination in housing and in employment and whilst pregnant, you know, so that's different. So that will be a totally different area where it's not, it wouldn't be something that I'm doing with the board, but it would be a workshop that we'll be doing, I'll be doing with my job as Commission on Human Rights to let people know of their rights within that time. But then when it comes to mental health, so we're gonna be bringing the awareness. So we are looking to see as to how many people, you know, I think with the summit, when we did the summit, we had close to 600 to 700 persons who, you know, who were present. So we want to put that out there. Before I continue, anyone, anything you want to add, anything? Because what I would like, let me just go through what I'm going through, and you could make your notes, and you want to add anything that you would like us to do for the year, because I'm trying to plan for the year. So we don't just be wasting time and just keep talking and talking and talking and talking and talking and nothing is happening. So I just want us to, you know, to just do stuff and just keep stuff going. So even with Mia, you know, Mia's in the office, she get calls, she get a lot of complaints or anything. So as I said to her, if anything that, you know, you would like us, you know, she's been in the office and she knows a lot of the needs of the community. So anything she would want our community to do, our committee to do, you know, just let us know. So she will also let her have the floor also, and in it on your area as well. So you're part of the committee. So I would like to hear from you as well. So I'll just finish what I'm doing here right now. So for February, I don't have I forget to mention that Melissa Severin, who is the secretary, and I'm happy that Mia is recording this. Melissa Severin, she lost a member of her family. I think her uncle died today. So she was not able to join us tonight. So our condolences to her. So for February, I'm looking to have a meeting with Department of Homeless Services because I have noticed that in our community since COVID, it has, which I mentioned last month, the increase of there's an increase in homelessness in our community. And we are not just saying one time you see like middle-aged persons, but we have man and woman, young people, you know, on the streets, and I don't know what's happening. I know a lot of people, they don't want to go to a shelter, but we know that the city have provisions for homeless people where they can send them to a hotel, because they have required a lot of hotels that was closing down. So they're putting them up in hotels. But for the shelters, I know, because I mean, I've had so many complaints at my job when it comes to people, especially young women, going to shelters. The older persons, it's the same thing. They rob them. You know, that the older people, they accumulate a lot of stuff, you know, and the young people, they get raped, you know. So it's a lot going on in the shelters. So that's why you find so many people on the streets. They don't want to go to the shelter, but yet still, as a community and being concerned for our community, it is one thing that we have to talk to the Department of Homeless Services to see what could be done. Because I don't know if you will notice that. I mean, right there, Grand Army Plaza, right where the cars right around. I mean, in the dead of winter and snowing, and you're seeing people lying there. I mean, it's not really part of our district, but we have a little piece of it. And then you're seeing people right there lying down on the benches in the dead of winter, you know, sleeping right on Empire Boulevard. They're there, and different areas in our community. As I drive around, I would see them, and it's terrible. And COVID, a lot of people lost their jobs. They don't have money to pay landlords, you know, and some people, I think they don't watch the news, or maybe don't have access to a computer, don't have access, they don't listen to the news to know that they have rights too, that if you are in an apartment and you lost your job because of COVID, you know, the landlord can push you out, you know. That's what they have the, what's the word that they have for this now? Help me, Mia.
What's the word that they have? Huh? What's the word you're looking for? What's the, to describe what?
What they implement for home landlords and tenants to give them a break. It would be,
the rent moratorium?
Right. You know, so people need to know their rights. So when the landlords push them out, they go out on the street and they don't know that they have rights, you know, that they should not live, you know. And then we have people also who are, you know, the immigrants, and they threaten them, and that, you know, we'll call ICE for you because you're not paying your rent, and then you would leave and they go out on the street. So all these things has to be addressed. And then also I want to meet with, have a meeting with DFTA as well, because with our seniors, you know, the services that, you know, that they really suffering, you know, the financial insecurities, you know, so we really want to see, really want to work with them and partner with JASA and New York Cares to support whatever areas that we can, whatever information that we can do. The only thing, we have some of our senior centers, and some of them you're able to meet. I think it's just one or two of them. When I called them, that I was at Shalom, I was able to speak to Shalom, and also St. Gabriel's, I was able to speak, but the other ones, no one really pick up, you know, and then to find out as to, hey, what's going on? Because I know when DFTA took over from the centers, when the centers were closed because of COVID, the database, all the information for the seniors, the directors of the centers, they send them over to DFTA. But looking at them, when I spoke to Miss Lawrence, it's like it was so difficult, because how many seniors pick up the phone and send a text to anybody? They just make a call, or they just pick up a call. They don't read text messages, you know, and they had food deliveries going to their homes. And because of COVID, some of the deliveries were being delivered to their homes, and the super or whoever is at the gate would not allow the people to take it up to them to the apartments. So they just drop it off downstairs. Some of those people, they can go downstairs to pick up the food, you know. So what provision they have for them, and some of them, they need the medication, you know. So it's so much happening with them. And when it's just like you're just butting heads against the wall, because when I try talking to them, I mean, one person is telling me one thing and somebody is telling me something else. And then they're telling you, okay, have the seniors to call 311, and then 311 will then put them in the system. So whatever food deliveries they need, whatever that they need, 311 will get in touch with them and with DFTA, and then they will, then when I call DFTA, they were like, oh yeah, well, that is one thing they're telling them, but guess what? We are not taking any more calls. We are not taking any more new clients. So what happened to those people? You know, and so they're saying that the only calls that they will take are people who are in the program, because a lot of the foods that were being delivered to the seniors, because of medical reasons, they can't eat some of those food. So they didn't want the food, they would not accept the food. So they were like, those people who want to opt out of the program, they take the calls and everything and put them out of the program, but they are not taking any more new people because they don't have the manpower to do all this delivery and do all this stuff. So then guess what? Our seniors are just left alone on the wayside, you know? So I have to look at my, who is Think Nick? G7 Think, who's this?
That's Mr. Almanor.
Oh, Mr. Almanor.
Hi, everyone. I'm just listening.
In New York's government,
okay.
And within our house.
I'm
right,
here, so I'm just following to see if I have anything to contribute. I'll just chime in. Okay?
Eric does not.
Okay, no problem. Thank you.
We need to bring
Thank you.
city's potential.
All right. So these are the stuff that is really getting to me, and then I have to look at my how do you call it? My list of committees to see the people who are on my committees, because I'm not seeing everyone coming in. So because we need to, if we have a committee, we have to work together. So at least I could delegate you know, so people can, you know, somebody can call this person and call that person, because all of us are working, so we could come together and get this thing going. So, okay, so I'm open up. Anyone have to say anything, any questions, any suggestions, any things that you think that we as a committee for Health and Social Services to pick up for this year, things that you would like to see done? Floor is open. I'm all ears.
So I'd like to just talk a little bit about the vaccinations, because as we are now embarking on that in the One Brooklyn Health System, getting first, which is kind of like following the protocol that the governor's office and the CDC had recommended, and that is for the healthcare workers to go first and nursing home residents to go first. However, because there has been not as much enthusiasm with those vaccines as we would have wanted with the healthcare workers, those parameters are being opened up to invite other persons in our community to have those vaccines sooner than they might have received them before. So I'm gonna be receiving a list. I know mental health organizations, advocacy organizations, drug and alcohol organizations are being allowed to come to our facilities and be vaccinated. So I'm going to forward a list to you that's an identifier of who can step up to be considered first priority now. And the second thing that I've learned is that there are places who are looking. I think that the city is looking for community-based organization locations to serve as vaccination sites. So I know One Brooklyn Health has been putting together a list of partners who would say, yes, I think that we would like to be a vaccination site, and to learn about what all that will entail. You know, how will they be trained? Who would be coming in? How will they utilize the space? What, if any, incentive will be given for those persons who are willing to use their spaces or their community organizations as vaccination spaces? I should have news by next week, because I think that there's a meeting tomorrow. But I would like to share that with the committee, because I think that there might be a lot of organizations who have been closed up, shut down, and not really doing very well financially, that maybe this is an opportunity for them to open up and participate, at least with becoming a spot for persons to be vaccinated and to get some information about how that might benefit them.
Well, that's very good, because on Monday, I went back to work on Monday, and I got word as soon as at 9:15, get online, we have to have a call, a meeting, because this is what the mayor wants from you. And I'm like, the mayor waiting at 9:15 in the morning to have me to come on a meeting. And then that was exactly what he was asking, to send a list. And I wish I had spoken to you before then, because he wanted a list of partners in the community where they can call them, you know, to for the vaccine, as to, you know, if they're members of the organization, we know, because they want to really reach out to the community to see who would be interested in getting vaccine.
Yes.
So some of the CBOs that I have, like the shelters and those, you know, so I send them some of those, and the majority of the places that I send was shelters, where they have the men shelters and they have the women shelters. So I send those to them.
Okay, good.
So many of us from our office, we were able to, at least they were just asking, like, because we are the community people, so we, and our interactions in the community, so we get all the reports and have to send it back to the mayor's office so they can do the count and do whatever. So we were able to do that. So I guess they were reaching out to other facilities as well, other partners and organizations in the community to get the numbers from them as well. So that's a good thing. Cool. So as soon when you get the report, thanks. So I'll be happy, because you have my email address, right?
Yes, I do. So as soon as I get that, I'll send to you and Mia.
Okay, cool. Okay. Miss Lewis, anything that you want to add? Whatever you would like us to do, whatever you see, and before I go to Miss Lewis, you need anything? I mean, as a community partner, what, as part of the Health and Social Services for our community, what you would like us as a board and as a committee that, you know, we could do, what you would like to see?
Well, I'd like to utilize the fact that we can't come together and do the community outreach and education that we have been doing for so many years. Kingsbrook had a Best Health School where we trained individuals in all manner of areas of chronic disease awareness and prevention, where they would get certificates for learning more about staying healthy. And we would go to churches, we would go to schools, we would have them come to us. And we had this wonderful integration where we educated over 3,000, 4,000 residents a year. And we know that we're lacking in that now because we don't have the access, but I think we can use the virtual scope to do that. And I think we can utilize maybe populating some of your education at these meetings monthly to bring education that's really, really valuable to the community and promote them robustly. So I don't know how willing you are to see, you know, a bigger audience here maybe on a quarterly basis, but I do think that it might be a wonderful opportunity for us to promote wellness on a regular basis and have One Brooklyn Health inject that to you regularly for 2021.
Okay. Mia, I see you shaking your head.
Yeah, I'm definitely in agreement with Enid. That would be great to have that quarterly. That would be just the right amount to draw in the community, because as we saw in our district needs statement, the chronic illnesses that, you know, plague our community, diabetes, high blood pressure, you name it, cancer, that information about wellness and just overall eating habits, that information, it'll just, we can never do enough.
Yeah.
To get it out there and engage the community.
And even too, to be honest, to make it fun, you know, the exercising and really giving persons an opportunity to do virtual exercise is really becoming a thing.
Yeah.
And
right.
We should make it fun one night, that the community come together with us and just do a wonderful exercise. Sabrina is great with this. Sabrina knows a lot of people who offer exercise. Sabrina, I'm sure you still do. If you don't, we can take that. But it's such a wonderful opportunity to get people moving collectively.
Right.
Yeah.
Hey, this is Warren.
I definitely like that idea.
Yeah,
Thank you very much for that, Enid.
You're welcome.
I support that 100%.
May I say something before you say? We cannot allow you to exercise one. We don't want you suing the board. We don't want you breaking your back. We don't want you to put your hip out of place. Old age is not welcome.
Well, if you're referring to me completing 5,000 miles on my bike this past year, I take the kudos.
Okay, we know you are in good shape, Warren. We know you're in good Warren. We know you're in good shape.
That was my COVID, how should I say, rebellion, okay? And it worked.
In the community,
okay, so
I just wanted to commend that. And with that said, Katie, if you can give me an ear with him or he can give us an ear, I think it would be beneficial to not only to where we are.
I like to say about that suggestion,
you know,
in terms of the health information. I think there's another committee. We could also partner like the youth committee to share that information with the young people, because the youth committee is having a lot of activities. I think their last shutout, the last activity, they had over 50 high school students. So I think it's a good thing if we could connect with them too, if we're doing health information, nutrition information, and even the exercise, which is an activity that can be sponsored by more than one committee.
It's something that I deal with every day.
I think when Enid was talking about the education and the youth community came to my mind also, and that's a good idea. I think you got into my mind, Almano. Because I was thinking of the same thing. I was like, we should.
Yeah. Classes on Mondays at 10.
I think that would be that would be great, and we should maybe, because you know, every time we come, we should surprise the people coming, and then as you said, we could have a game night tonight. You know, we can have a come and then have families to come and have a game night. You know, the exercise and, you know, do different stuff, and you know, invite people. But with all those programs that's coming up, just what we will do, I'll be working with Mia, and then we will work, we'll have flyers put together, and then we'll be sending out. So each person represented on the committee will give them a flyer, and then they can send the flyers to the network, add it to the listserv and send it out, so we can have, because I think, Mia, we can accommodate the Zoom platform we have. Can we accommodate like 500 people?
You're
muted.
I'm muted. I have to check to see what the capacity is, double check.
Okay.
No,
because
that's correct. So we have a lot of work to do, Francisca.
You said what, Warren?
I said 500 is correct. So
okay.
That means we have 496 people to do, okay?
Warren, we may not have got 500 persons coming, but at least as long as we have the capacity, it could hold the capacity. So whoever come on, then we know we are able to, accommodate them. So we will have a flyer, and then we update it as we go. And so our first one, so for anything for this month, we will have our vaccine awareness, and then, but I would rather use this platform. So you're looking for the educational thing that you were talking about, and we're looking to do it quarterly, right?
Yes, and I'm gonna get a schedule to you guys with some recommendations, and then you guys will choose from that menu what you think would be a nice lineup, and then I'll lock them in.
Okay, thank you.
You're welcome.
Sabrina?
Hello, I'm here.
Okay.
So yes to education. You all here who know me already know that, as an ambassador of wellness, I'm definitely 100% into making sure the community is educated holistically. It's dimensional. It's dimensional wellness. It's not just what we eat. It's not just physical activity. It's everything. I would like to see mental health education more so with our seniors as well as our youth. There's many suicides taking place right now over the holidays. 30%, the numbers has definitely been going up in our communities. And I don't think that they're really being, right? And I don't think that children are really being paid attention to as they should. Homeschooling has been just really challenging for parents as well as children. And it's still a concern. You have more families working in entrepreneurship as opposed to a 9-to-5, but then you have those who are balancing a 9-to-5 and also entrepreneurship and also home care and also caregiving. And so you have, the adult population as well, right? That needs help with caregiving and then being a parent. And so I would like to see mental health because when we don't deal with it from both clinical as well as holistic standpoints, it turns into disease. And we see that more and more every day in hypertension. We see that in obesity. And so when we have our meeting in dealing with obesity and diabetes, we have to input mental health in that. We have to be able to marry all of that together because it's issues that are not being talked about, that people are really suffering with. And so for me, in being in the field every day in community health, talking to individuals, walking into families, it's just like, it's almost devastating that we can't hands-on do anything immediate. It's like, dang, I wish I had $100,000 so I can just give you some money and everything will be all right. But that's not the reality. And so if we're gonna be community leaders in Community Board 9, Brooklyn, which is the #1 hotspot, right? This is where everybody is coming. This is where everybody wants to be. And being that we're very diverse, I think that we should utilize all of our gifts, skills, and talents, reach out to even my building, we just created a WhatsApp group, my building, for packages that was being stolen over the holidays, right? And so it's bridged us together in ways that we would have never come together before, like ever. I know neighbors that has been here for 10 years that has never spoke to me a day in life. And I took a package up to them and it was just like, oh, hey, yeah, you're downstairs 1C. you know, it was amazing. And so if we can we could still develop a level of connectivity, connectedness, so that people won't feel completely disconnected. So I love what Enid said about the education. We did that at Kingsburg. I love doing that. It was one of my favorite things to do. And so, you know, every month there is an awareness, right? And so in us planning, Madam Chair, I'll get back to you on other ideas that we could incorporate on a monthly basis on maybe Enid's platform with Kingsburg. You know, being that we have that platform, it's a whole state-of-the-art studio there that can be utilized for the education, for the fitness demonstrations can still be done. There's a plethora of really great fitness professionals. I'm not doing physical fitness for the huge population. I have a few clients, but that's not my forte right now. My forte right now is just focusing on educating on dimensional wellness and making sure that we have public policies and resolutions in place to see the change that we want to see. Health equities is still a thing, you know, so we just have to make sure that we're being present and meeting the needs. We have to listen more and talk less to hear the needs of the people, because all this sounds great, but what do people want? Like, what do people really need? I think that, you know, we can create a platform where we can get results, like we can actually hear people's opinions. You know, we want to hear from people. That's all I have, really. I hope I answered. I know I went all over the place.
I'm happy that no, you're not all over the place. It's just like, you know, things that we bring into the table. And that's the reason why when I was thinking of the agenda, I say I have to leave the floor open, because we have people who I may not be thinking of something, but somebody have that in their mind and things that we want to meet the needs of the people in our community. And I'm happy that you brought up the mental health, because mental health has always been in top on my list, and I forgot to bring it up. So I'm happy that you brought it up, and I think that I'm going to put place it in there for April, so that we can we have some time to put it together and have a mental health forum.
Madam Chair.
Yeah.
Can we also add financial health in there as well? It's not a joke. It's not a joke, but the reality is I met with the family the other day, and the only reason why they're having mental illnesses and back pain is because they didn't pay their Con Edison bill that they thought their lights was going to be shut off. And the truth is, when we're stressed about bills and money, it can create pain that don't even exist. You go to a party and start dancing, you don't feel no pain until you get home.
Let me say something to you. You're talking about this, it's not a joke, because I went out on the street this afternoon, and then this gentleman, I want to get my head on, and this gentleman came on and he was like, you know what, it is serious out there. And I'm like, what happened? So I thought he was talking about what, you know, was happening in Washington. And then he said, can you imagine losing your job? You just had your job and you just don't know why you lost your job. You just lost your job. You have your kids crying for food, and then you can't pay your rent and you can't pay your bill. That flips you off. That takes a toll on you. And I don't know, so many, then we have so many young people who lost their mother and father, both parents, for with COVID. You know, that's messing up with the kids' head. You know, and then you've heard so many people, so it's not been reported. Do you know how many suicides? So many people who have committed suicide. It's just that it's not been reported. Exactly. You know, there's like, oh, we didn't see this person for how many days, and when they go in their homes that they do, this person is missing. You know, I mean, since COVID, a lot of people has committed suicide. Now, since suicide was on a rise, and now it's worse. It's worse because of COVID. There's a lot of parents, and there were men who killed themselves and the children and then the whole family because they cannot provide for them. They don't have food for them. And it always brings me back home in Barbados. I remember in '92, in the 90s, Clinton was still in power, right? And I don't know if you all remember when Clinton had the accident and he broke his ankle or something. He was walking with crutches. It was during that same era. And the Barbados went through a recession. It wasn't like an epidemic like this, but recession. And the government, they was sending home people So if you had two, let's say up here you have two persons working for the city, they never look to say, oh, both of these persons working for the city, so we'll keep one and send one home. They would send home both persons, breadwinners of the home. So they have the mortgage, they have the kids going to college, they have their bills to pay, and mother and father send home. And so many people lost their lives. Men used to go up in a place in, I don't know any of you have been to Barbados, in St. Philip, and St. Philip, it's like high rocks and the sea is below, and they would just jump off because they couldn't take care of their parents, they couldn't take care of their families, you know? So up here, that's not happening. No one have nowhere to jump off. They're shooting their families, you know? Some of them, they slash their kids' throat, you know, they just, because it's a mental thing for them. I cannot provide for my family, and you are so right. And then we need help for the adults, for the mothers, the daddies, grandmothers, and whoever that their children died and left their grandkids to them, or sisters who their family died and they have to take care of the young ones that they themselves and working. And then we have the little ones who've lost their parents. You know, so we need to get help. We need to get help for them. Warren, I'm Warren. Let me hear you. Mr. Burke, are you there? We meet with behavioral health.
Yes, I'm here. I just was having trouble unmuting myself. Usually Mia mutes me, but I did this myself. So anyway, I have some observations here. Number one, Sabrina, what you're saying is 100% correct. And one of the things that, and let me preface this by saying I do have a mental health diagnosis, and I have been through certain systems, so I know what's going on firsthand. But the major thing that I see systemically is that everyone talks a good game and there's money thrown at everything, but it doesn't trickle down to the end user, the people who you're speaking about. And it's a consistent problem. I'll give you a great example. When de Blasio was first elected, I was chair of the Department of Mental Health Advisory Board, and there was so much money being thrown that they couldn't implement it. There was 30 million here, 20 million there, 10 million there, and it doesn't trickle down. And the things that you're talking about means that we really have to refocus on how do we reach, to use a business term, the end user. And in my evaluation, it's just been a failure. So there's a lot of work to do. I think that we can approach certain things on certain issues, but we really have to start speaking to our elected officials and tell them to stop talking and start acting and getting the money to the end user. Because the father who can't support his family, or the people who are losing families, really need help. And I don't think they're getting it. And I don't have a great evaluation of programs. I think there's a whole bunch of people making money who are administrating these programs, and we're not getting it down to the people who need it. It's a huge problem. I don't have an answer, but it's something that just really disturbs me. Thank you.
Thank you much. So I think that in this is a panel, we have to put a panel together also, so we could have people, we have the electives, we could invite them to come to speak, to hear what they have to say, and then, it is something that we have to work on as well, because it's very important for our community.
Can I piggyback on that, Francesca?
Sure.
I think we have to identify certain issues, okay, and not bite off more than we can chew, because we won't solve the world, but say, this is what we want to identify, this is what we want to solve, and then ask them the specific questions.
Well, so that's what we are doing. So that's why we are having this dialogue so that we could come up after the areas. And then I think that we have a good outline, because I noticed that, you know, many times we have our meetings and then, you know, there's so much that's being said, but not enough is being done. So for this year, I want us to be able to implement the things that we talk about and not just have meetings and not implementing everything. We may not be able to get all the results that we would like to.
I will say one more thing. I was disturbed in the news today about Northwell Health that they
yes,
like
yes,
thousands of bills to people.
Yes.
For COVID-related expenses. And it just amazes me. As soon as it was brought to the public, they announced they wouldn't do it. But you talk about the stress that Sabrina's talking about, that all of a sudden a family gets a $1,400 bill, a $700 bill. I mean, this is weekly salaries, okay?
Yeah, and they're not working.
I just find it amazing.
Yeah, they're not, but the thing is that, what is the governor doing about it? Because I mean, these are his allies. So what is he doing? And well, we haven't heard, because I think when I read the article, when it came out, so they withdrew the lawsuits that they had against those patients. I mean, I lost my job and I had COVID or whatever, and I come to your facility, you know, for treatment, and then you are sending me a bill for $9,000, $700, and $800. And you send it to a poor guy who's working in a restaurant in a kitchen. He's not even making $400 a week, you know, and now he's not working, and he can't even feed his family, and you're suing him. And, you know, it's crazy. It is crazy. So, hey, anyway, it's after 9, after 8. It was not my intention to keep you guys, you know, past 8 o'clock, but I'm happy for, you know, the dialogue. I'm happy for the information, and I will be in touch with you next week, Mia, or maybe tomorrow. I'm gonna give you a call, so then we could coordinate for next week. Friday. Does Fridays look better for you, Mia? What days look better for you for distribution of masks? Because I have to go according to your schedule and fit it in mine. You're muted.
I hate that. We'll talk tomorrow. I'll let you know.
Okay.
For next week.
Okay.
Okie dokie.
Yes. So I thank you guys so much. I thank you, Enid. I thank you, Mr. Almanor. I thank you, Mia, Warren, and Sabrina, for your input. I'm sorry?
I say I'm always happy to help and contribute. I'm always happy to help and contribute. Yeah.
Thank you. So I'm looking forward for us doing this committee to do, you know, good work, you know, for our community, for our seniors, you know, and just to, as much as we can do. I mean, hey, we are not fairies. We don't have a wand, and then to wave it and everything's gonna be okay dokie, but we'll just do the best that we can. That's all we can do our best.
I wanted to just say one more thing. I've been a science teacher for most of my life. I'm feeling a little bit bad that so many people are resistant to the vaccine. And I think this is a result of our science education, which is lacking. So this is something I just wanted to put that on the record. So we need to really work with the youth movement start really. So because there shouldn't be resistance to the vaccine if you understand the science. And I think that's part of the education failure we have in the city.
David, I'll text you, and then and then we'll be in contact. And
thank you much. Thank you, everybody. Please
I came in late, but I was listening.
Okay. Thank you.
Indeed, we will have dialogue with Mia tomorrow, so we'll let you know, as to where we are going, because I think we'll start our mass distribution, because the first Mia, do we count the train station on Eastern Parkway as part of our district? No?
Yeah. The 3, as long as it's on our side of the mall, yeah.
Okay. All right, so we'll let you know as to what we're doing. We'll send out an email.
Okay.
You know, so because we don't want people to say, hey, they went out to do stuff and they didn't say. So
Right.
we'll send out an email to let the community know what we are doing, where we are going. So
Okay.
whoever wants to come to lend a hand, you know, then they could come. Okay.
Sounds
Thank you
good.
guys so much. Stay warm and please stay safe.
Stay safe,
Thank
guys.
you,
Okay.
Princess,
Have a great
for the
night.
meeting.
Good
All right,
night.
good night, everyone.
I just wanted
Good
to give
night,
a shout out.
everyone.
Night.
Hold on a minute. Warren is saying something. Hold on.
Yeah, I want
What,
to give
Warren?
I want to give Mr. Albanor a shout out because he is just being a excellent community board member, attending meetings and giving his views. So
Yes, he is.
thank you, Mr. Albanor.
Oh, you're welcome, Warren. You're welcome. Have a
Thank
good
you.
night.
Yeah, have a good night. Good night, Sabrina. And Sabrina, I did send in my stuff. Did you see it? I did register, Sabrina.
You did? Oh,
I
congratulations
registered. I
and
got my
welcome to the
certificate.
Brooklyn. Welcome on board. Listen, I'm happy. I said, welcome to the Brooklyn NAACP. We're expanding our platform, CB9 and NAACP. We're going to be doing amazing work. So I'm happy that we have this committee. I'm looking forward to, you know, I'll speak with you off the grid about, you know, what my contribution could be. And I'll see if I can hook up with you and Mia.
Hi, Sabrina.
Hey, Mia. Hugs and kisses, girl. You still in the office? Blessings and love to you.
No, I'm at the dining room table.
Oh, good for you.
Yeah, she's in the office at the dining room table.
That is the office. That's Sabrina, the office away from the office.
Okay. Good night, everyone.
Good night, guys. Be safe. Take care.
Bye. Thanks again.
Love. Good night.
Bye.
One more.